Security benefits, yes, absolutely they can. There's a lot of different categories for child benefits in Social Security. So I'm going to go into all of those today, and this is also a live Q&A. Looks like I already got a bunch of questions. And so I'll get to as many of those as possible, but we'll go down the list and I'll let you know. So if, as usual, if this information is not useful for you, there just might be someone around you that needs this information. So make sure you like and share and subscribe and do all that algorithm type BS that we have to do so the information gets out to people that need it. All right, let's go ahead and get started. So what are we looking at? All right, let's go down the list. I put in some acronyms in there, but I'll talk about each one of those. So one of the first things a lot of people don't know, I'm going to start from the scratch here, is it's called low birth weight children, babies that are born low birth weight. Social Security is about 2 pounds and 10 ounces, or any child that's born that has, not necessarily that weight, but has some very chronic conditions, some terrible conditions when they're first born. They are eligible for SSI, which is Supplemental Security Income. A lot of people think that SSI means Social Security Income. No, SSI is a completely different program that the Social Security Administration administers. It's called Supplemental Security Income, low income, low resources. So what my office used to do, what all other offices throughout the country, not sure they do it anymore because there's, so many thousands of people have been cut from staff and they're barely surviving these offices out there, trying to help people. But what used to happen is, for instance, we had an employee in our office, hey, Camille, retired now. She used to go out to the hospitals, and anytime there was a low birth weight baby that was born that needed to file, the parents needed to file for SSI, Supplemental Security Income, she went out there to the hospitals and took care of it. So it does happen. And one of the things about SSI, another reason parents want to file for it, even if they're, don't necessarily need the money, because on SSI, the max you can receive is $967. But health insurance, because of that, when you receive SSI, again, Supplemental Security Income, it's a low income, low resource program Social Security administers. If you receive SSI, even $1 of SSI, you are what's called categorically eligible for Medicaid, whatever Medicaid is called in your particular state, Denali Care, or Medi-Cal, or Sooner Care, whatever it's called. That's Medicaid, it's federal Medicaid. Then, so again, if you're receiving $1 of SSI, you're categorically eligible for Medicaid. And that's usually what these parents are looking for when they have a very sick child that was just born, is they need medical care, they need health insurance immediately. So they get the SSI and they immediately get Medicaid. So it helps a lot of people out. All right, and then there's also just regular child disability benefits, and there's a couple of programs for child disability, but I'll start with SSI. So if you have a child that is 5, 6, 7, 15, whatever, that is disabled, and again, low income, low resource for this one because it's a SSI program, then you can file for SSI for that child if it's a disabled child. They will take, other resources and income in the house into consideration. And there's different, it gets complicated. Who's living in the house? There's the tax household and the personal household. So there's a lot of different things. So I always say with any of these programs, if you think you're eligible, if you think that someone's eligible and they need that extra income or they need that health insurance, then please apply, and go through the process. And if they deny you, and you think you should be approved, appeal, fight, always. So the child disability benefits, you apply for that in the same type of situation. You're able to get up to $967. But again, same situation. If you get SSI or if you're approved for SSI, then you automatically get Medicaid, not Medicare. You don't get Medicare from being on SSI, because if you're on SSI, unless you're also getting, some people can get regular Social Security benefits and SSI. One offsets the other. So there's some people out there that are getting regular benefits, retirement benefits, or disability benefits on their own record, but their benefit amount is so low that they're also getting SSI. So people will say, Ed, no, you're wrong. I'm getting SSI and I have Medicare. That's because you're also receiving a little bit of regular Social Security as well, retirement benefits, disability benefits, spouse benefits, surviving spouse benefits, and that's where you're getting Medicare from. But if you're just getting SSI, then the only thing you're eligible for is Medicaid. Unless this, I guess there's exceptions there, unless the state has decided to pay for your Medicare for you. So not many states nowadays are doing that, but in that particular situation, there's another program our regular viewers know about, Medicare Savings Program, but we won't get into that one today. Okay, so Medicaid, that's through the state. So if you apply for Medicaid directly through the state, they'll probably tell you, hey, have you tried filing for SSI since you're disabled? Get all the benefits you're eligible for. A lot of people, again, you can get regular retirement benefits or surviving spouse benefits or disability benefits on your own record. You can also get SSI. Because you're getting SSI, you can also get Medicaid. If you're receiving benefits, you can also get the Medicare. If you're on disability, it takes 2 years to get that. You can also get the extra help with prescription drug plan. You can also get the Medicare Savings Program, which the state helps you pay for your $185 Medicare Part B program. So there's so many different programs, and people often, unfortunately, miss this connection, and that's why so many people out there are struggling. They have stuff out there, but people just don't know about it. So please, again, share, like, subscribe, or whatever. All right, so here's the big one everybody's waiting for probably. Auxiliary child benefits. So if a parent is receiving retirement benefits or disability benefits, then those children, stepchildren as well, under certain circumstances, you have to support that child 50% support. But if a parent is receiving retirement benefits or disability benefits, that is SSDI, Social Security Disability Insurance, not SSI, but Social Security Disability Insurance, then the child can get benefits on that person's record. It's called the auxiliary child benefits. And how much can that child get? Up to 50% or up to 75%. Why are the two different? If the parent is alive, then up to 50%. As a surviving child or surviving child, then up to 75%. And why do I say up to? If there's just one child on there, then it's 50% or 75%. But there's what's called the family max. There's a maximum that Social Security can pay out on a particular record. And this is all, congressional policy that they passed. It's called the family max. So basically it says, okay, hey, if you have, 1 or 2 children, then, they'll receive the 50% or 75%. But if you have like 10 or 15 or 20 children, they're not all going to receive 50% of the benefit. And I guess I should answer what 50% of what is. If the parent is receiving, let's say, disability benefits, and the parent's benefit is $2,000, then the child will receive half of that, $1,000. Okay, or if the parent passes away, then the child will receive 75%. So again, up to. But if it's just one child, then 50%. But if you have like 10 children, not all 10 children are going to receive, half of that. $1,000. That's $10,000. Congress said, yeah, there's a maximum where we're going to be able to pay out on this. So what happens is if you reach the maximum, if you have 2 children, 3 children, 4 children or something, they'll say, okay, the maximum we can pay out on this record, for instance, let's say it's $5,000. And you are receiving $2,000. So $5,000 minus $2,000 or $3,000 left over. So if you got 3 kids, each child will receive $1,000. So if you got 4 kids, no, not each kid will receive $1,000. They'll take the remainder and divide it by however many children you have. So that's how that calculation, same type of thing for surviving child benefits as well. There's that family max. And on my website, I have a little bit more detail. Let me go ahead and pull up my website here so you can see it. It's mygovexpert.com, and it's all free, so you can check it out. Retirement, disability, family benefits, and you've got child benefits there, and it has a little calculator that it kind of gives you a rough estimate of what the family maximum will be, and benefit calculations. Grandchildren, big question that I always ask. Can grandchildren receive benefits on the grandparents' record? Yes. But the parents have to be deceased or disabled. So, the grandparents' parents are deceased. The grandchild's parents are deceased or disabled. So either deceased, or disabled. And the child has to be at least 18 years old. And I'll get into a little bit more detail there. If you adopt that child, if the grandparents adopt that child, then that's a slam dunk. Then that's your child. But if you didn't adopt that child, if you're just custody, then unfortunately, grandparents can't get benefits for the children based on their record, unless the parents are deceased or disabled. And then if the parent is deceased, then the child just might be able to receive survivor benefits on that record. So, all right. So how old can they get, how old do they have to be to get children's benefits? Up to 18 years old. But if the child is still in high school, it continues until they graduate high school, or 19 and 2 months. Technically 19, they give you a couple of gray area 2 months there. So it's 19 and 2 months. What happens if the child is receiving benefits, child benefits, then the benefits essentially stop at the age of 18, and you just have to fill out a form, SSA 1372, that says the child is still in high school. You just take that form to the high school, and the high school fills it out and say, yeah, the child is still in school, graduate, and will graduate in May, and the benefits will essentially continue until the child graduates high school. So, or if the child is what's called a DAC, disabled adult child, a child can receive benefits if they're disabled, if their disability began under the age of 22. It's called disabled adult child benefits. So if you have a child that became disabled before the age of 22, that child can receive benefits on either their parents' records that are receiving retirement benefits or disability benefits, or passed away. The child, as a disabled adult child, can receive benefits on that record forever, as long as they're continuing to be disabled. So disabled adult child benefits before the age, again, disability had to begin before the age of 22. So it's a regular disability type application. If a child is receiving regular benefits as a child, let's see, the child is like 15 or 16 years old, and then the child turns 18, again, the whole thing will kind of stop. You can continue it a little bit until they graduate, but if at that time you say, well, the child's disabled, then you have to go through the disability thing close to the 18th birthday and file for the disability, because that takes, nowadays it takes months and months and months to get that approved. So they will switch from regular, child benefits under the age of 18 and switch to disabled adult child benefits. So, and that will continue. And then there's another one. If it's called the auxiliary child in care benefits. So if a child is receiving Social Security benefits, let's say on another spouse, because that spouse is receiving disability or retirement benefits, then the other spouse can receive benefits. It's called auxiliary child in care, because the other spouse is kind of like staying home or reducing their income to take care of that child. The child has to be under the age of 16, under 16, or that child is a disabled adult child. So if you're taking care of a parent who's on disability, or they passed away, and the other parent is, essentially taking care of that child, even if that child is 20 or 30, years old, it doesn't necessarily matter. As long as you are taking care of that child, you have that child in care, you can receive benefits until basically you turn your full retirement age, and then your benefits just switch to regular benefits. But child and care benefit, so it has to be under 16, and there's work limitations. So those type of thing, it basically Congress is saying, okay, you have the other parent that, because that child is young, under 16, or that child is disabled, the other parent needs to stay home to take care of that child, and therefore they're not working. So, but if you're working, and this year that it means over $23,400, anything over $23,400, then they take $1 for every $2 you go over that amount. And that auxiliary child and care benefits, sometimes people don't, here's what they mess up. They say, okay, if you have, let's say you have the parent starts receiving retirement benefits or disability benefits or whatever, and then you've got a couple of children that receive benefits as children. And then you say, well, I want to go ahead and file for, the child and care because I'm taking care of that. You still have to calculate the family max in there. So sometimes people don't file for the child and care benefits because the family max is already being paid out. But here's where people mess up is when one of those children stop receiving benefits because they, reach 18 or something, then that opens up that family max. So there's probably thousands of people out there that can get more money, but they weren't told when situations change like that and there's no more issue with the family max, then that person can get those benefits. So, and it doesn't affect your benefits at all. People say, well, 20 years ago, I got those child and care benefits. Will it reduce benefits when I file for survivor benefits on that person's record or retirement benefits on my own record? No, won't affect it at all. Okay, one exception. It might change your direct deposit date. Sometimes when you're on a particular record and you've been receiving it for a long time, they might change your date direct deposit to the 3rd instead of the 15th or something like that because you were receiving it, years ago. But yeah, everything else stays exactly the same. So there's always exceptions, and it's all crazy. So for more details, and if you watch this video and make sure you pass it on, and my website, again, it gets into retirement, disability, survivor, family benefits, overpayments, veterans, Medicaid, appeals, how to fight for anything that you disagree with, and it talks about spouse benefits. It's got some free calculators in there, divorce spouse benefits, independently entitled, child benefits, child and care, Medicare, Medicaid, all the rest of it. So if you got any questions, you can reach out to there or ssa.gov if you like reading the bureaucratic English part of it. So there's all that. All right, let's get into some actual questions and let's see what we got. David, we had triplets in 1994, wow, and took advantage of this. One of our children has been disabled since birth and received all the benefits you have suggested. He will go on my Social Security soon when I turn 70. All right, good deal. So sounds like Social Security took care of you and you got all your benefits in time. Yeah, a lot of people don't realize that. They say, well, I'm not going to, Social Security, it's not going to be there and stuff. Everybody could very well need Social Security tomorrow. You are one very, very, very bad day away from needing Social Security. Nobody knows what's going to happen tomorrow. Social Security is a social safety net. And you're like, well, when I get 67 years old, will it still be there? But yeah, all of us on this community are pushing to make sure it is still there. But be that as may, you could very well, hopefully, knock on wood, hopefully you won't need it tomorrow. But it is there for you tomorrow, and people don't realize, that's what it's all about. So good. So one of our children has been disabled since birth and has received all the benefits. He will go on my year Social Security when I turn 70. Yeah. So getting it from another record, it sounds like. So you're going to start your benefits later. So yeah. Make sure, remember 50% and then 75%. Joseph, I got my first annual notice of change and don't like it. Yeah, I've heard that a lot. So the annual notice of change for those people that have got Medicare Advantage or Part D prescription drug plans, it's going to tell you what your plan is going to look like because they all essentially expire December 31st, and you get automatically re-enrolled in the same exact plan unless you're like Joseph and you're like, well, I don't like the new plan that they're going to re-enroll me in. Sure, it's my same card as I have now and maybe my same doctor, but they can change all of the details. And people think, oh, I've been on the same plan for 2 years. No, you haven't. You've been on this plan since January 1. Maybe the name of your plan is the same as last year, but a lot of the details, especially this year, are going to change. So Joseph, yeah, make sure you reach out to, whoever, broker, agent that can help you out, or you can reach out to Chapter. And October 1st is the first day people are going to be able to see what the new plans are for 2026. And the first day you can change is October 15th. You're probably not going to be able to get into Chapter or any place on that particular day because there's about 1 million people that are going to be, their plans are going to be canceled, but you have until December 7th. So be prepared. Get your providers together, get your prescriptions together, and just be patient and get it done by December 7th. And the new plan won't take effect until January 1st. So we'll make sure they take care of you. Becky, my grandson has been denied 3 times for SSI, and he has schizophrenia and is severely impaired and is currently in the hospital. Wow, he is 20 years old and will be 21 next month, and he really needs it. So hopefully, denied 3 times. Does that mean he went all the way to the administrative law judge? Because what people do sometimes is they apply and they're denied, and then they, forget about it and get frustrated and give up. And then months later, they apply again and they're denied. That's not the way to do it. The way to do it is you apply, and if they deny you, then you fight that denial. Okay. So on my website, you click on the appeals there, and it gives you the 4 levels of appeal. So you're denied, you immediately fight it, and which is a super easy way to do it, SSA 561. And then if you're denied there, you go to the next level, the administrative law judge, and it has the form there. It tells you some tips, tricks, and secrets. You can hire a lawyer if you want. Most of the times, if you're just receiving SSI, if the child is just eligible for SSI, then a lot of lawyers won't take it because they don't make any money on those. But there might be a lawyer that you can find. But the first 2 stages, the initial stage, you can hire a lawyer if you want, but they're just going to basically do the same thing, you do, answer questions. But the 3rd level, when you hit the administrative law judge phase, then I would recommend finding a good local lawyer. So, but I don't want to disparage lawyers because they're very litigious. You can hire a lawyer anytime you want. So, if you own a house and unemployed after working 25 years, what benefits are entitled? Yeah, houses don't affect any type of welfare, needs-based programs like SSI. Your home and your car are exempt because people have to live and, get to doctor's appointments and stuff. So the Social Security doesn't hold that against them. And most Medicaid programs throughout the United States, same type of situation. I think there's one state that says if your car is worth over some amount of money, then you're not allowed to. But anyway, most states, your home that you live in, if you have like a home and then a second home or a home and a property, then that property is going to be held against you for, those needs-based programs. And I've had people that had a car and then another car on blocks in the front yard, and that was counted against them because it was registered in their name. They had a hard time getting that out of their name so they could get benefits. But and then if you've been working 25 years, then you're probably still in your 50s or so. Or unless you're like some of us that started working at 14 years old, cutting grass or delivering newspapers. But anyway. Are children who are diagnosed with autism eligible? Yes. I did a video. It's been a few months now. I was asked to do a video on that from Autism, Oklahoma. So I did a video on autism, and absolutely. tough sometimes because, it's a spectrum. So Social Security defines disability as kind of the inability to work ultimately, but you're like children, not work anyway. They kind of, take the same type of criteria, but it's different for children. And that's why when children are receiving disability benefits as a child, when they turn 18, they have to be reevaluated on more stringent work type criteria. But yeah, absolutely. My philosophy on this: if you think a child is disabled, and it's going to be very tough for them to go to school and work in the future and stuff like that, please, please, please apply. Please apply. And because another thing it does, if you go ahead and apply now, they contact your doctor, that child's doctors and hospitals and clinics and everything, and get medical records, and they might deny that person now, that child now, but perhaps, with some conditions it gets worse, 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 and worse, and then, at 24 years old, they decide to file for benefits, and remember, you have to be disabled before the age of 22, but now that child has a bunch of records that are already out there. So when that child files at 24, Social Security already has some records that exist before the age of 22. So it makes it a tad bit easier. So always, always apply. Please, please, please. Let's see. Withdrawal not available due to 5 prior years of disability. Automatic conversion at FRA. Yeah, withdrawal of application. You can withdraw applications within 12 months, and pay all that money back. But yeah, in your case, it doesn't sound like that's possible. But yes, your disability automatically converts to regular benefits at your full retirement age. So thanks so much for the subject matter of today's live stream. It helps so many help their family members. Yes. Just like this community here, we've got the best community on the internet, on social media. People out there, this doesn't apply to me, I don't have children, but I'm sure you know people that do have children down the street, that you see, maybe blowing up your tulips or something like that. No, I did not blow up my neighbor's tulips. Okay, I did. Firecrackers, what are you going to do? Not entitled for retirement yet, only 60 years old. Okay, all right. Remember, disability benefits, surviving spouse benefits start at 60 years old. A lot of people miss that. They think 62 is 62 or, full retirement age for everything. No, for survivor benefits, you can start at 60. And disability benefits, you can start, as you can see, at any age, right? Richard, what's up, Richard? I turned 69 in December and will work a few more years. Creditable health care at work, but pay a little extra for a slightly better plan. Can I start Medicare A now, or must I wait until I start Social Security at 70? No, absolutely. You can start A now. And you didn't start it when you turned 65 because you had creditable coverage from work. So you're good. So all you have to do is you go ahead. Well, you're going to be doing A, so that's not an issue. If you were going to also sign up for B, to avoid the penalties, you'd have to provide a couple of forms. And that's, after, in your case, you're not losing your job. You just want to sign up. So if you also want to sign up for Part B, to avoid the penalty, you'll need this form right here, the L564, that you take to your employer, and your employer fills it out and says, yes, don't penalize this person for not signing up for Part B when they turn 65 because they had creditable coverage. But if you're just going to sign up for Part A, you don't need that. So yeah, you can sign up for Part A and just tell them, don't start my money. Or you can say, sign up for my money and start A, but not B. But yeah, you can just sign up for Part A. And some people do that because maybe Part A, you've done the calculation and you've determined that your deductible or your hospital deductible at your work plan is more. The deductible for a hospital for Medicare Part A this year is $1,676. That's not an annual deductible. You could pay that several times if you go into the hospital several times, but sometimes it pays out. It helps, and it's zero premium. So there's that. You can apply for SSI, which is supplemental security income. It's given based on income. It's not part of Social Security. They merely administer the payments. Exactly. So Social Security offices are broken up into kind of two units in the back. Title II, which I was when I worked at Social Security before I became a manager. That's the people that do retirement benefits and surviving benefits and Social Security disability and Medicare. And then you have SSI, which is supplemental security income. So let's see here. Rick, I'm single, divorce with that lovely $255 death payment. My girls will not get that if they're adults, which they are. Correct. That is correct. We used to have people show up all the time and want to get that $255 and their adult children. And unfortunately, no, it only goes to, if that adult child is receiving benefits on their parent's record and the parent passes away, then yes, they'll receive the $255. But other than that, it goes to the surviving married spouse that lived in the same household. Or it goes to the children who are receiving benefits off of that person's record. And it's crazy if you've got, if the parent passes away and you've got two children that are, under the age of 18, let's say, and receiving benefits, then Social Security has to take that $255 and divide it by 2 and give half to each. It's crazy. So it's never enough. So you can reach out to David DeFore and his people there if you're looking for final expenses called burial insurance. If you want more something than the $255 to leave your family, give them a call and they can give you a free quote, see if it's will help you out. And David supports our channel and supports our website and supports the new program platform we're putting together. So we appreciate it. So if you support him, you support us. We appreciate it. Let's see. Hey, Bella, how we doing today? Focus lady, let's see. If someone on SSDI retroactively eligible for adult disabled child benefits prior to the age of 22, if records are available and what specific records are considered evidence for that? Yes, if when you apply for SSDI, Social Security Disability Insurance, they were supposed to check that, but unfortunately, with the super low staffing, there, even worse. And even before this current administration, Social Security was at a 50-year low in terms of staffing, but now it's even 10 times worse. But when you file for SSDI, they're supposed to look at that. They're saying, hey, okay, you want to file for disability benefits? They look at both. They look at SSI. Are you eligible for SSI? Oh, you're not eligible for SSI because you got too much money, or your regular disability is going to be too much. And so we'll go ahead and forget that one. And we'll go ahead and sign you up for SSDI on your own record. But they should also check to see if you're eligible for disabled adult child benefits. But normally, if you are receiving SSDI, that means you are eligible for SSDI, and that means you did work, and that means probably that you worked over the age of 22. So that probably, normally, there are some exceptions. That probably means you're not eligible for disabled adult child benefits because, sure, your disability began before the age of 22, but you were able to work after the age of 22 or after 18 or whatever the case may be. So you had some type of history of working, and that's how Social Security determines your eligibility for disability is your inability to work. So people have disabilities, but they're able to work. Guy named Franklin Delano Roosevelt, guy named Stephen Hawking, neither of those people would be considered disabled in terms of eligibility for Social Security because they were working. So I'm hoping know who those two people are, right? You have to be 65 or disabled and low income to get SSI. You have to be 65 or disabled. Correct. So yes, thank you, Patricia York. So SSI, supplemental security income, you can get it based on your disability, or if you're 65 and older. So if you know some people out there that are 65 years and older, and they're having a hard time, and their Social Security checks is under $967, please tell them to reach out to Social Security and file for SSI, supplemental security income. What's supposed to happen if someone is 65 or older and they weren't able to get it on disability when they're 65 and older, if they're only getting, $400 or $500, $600 from, their retirement benefits or spouse benefits or surviving spouse benefits or something, then Social Security should have contacted that person and said, hey, do you have any other income or resources or anything like that? No? Okay, we need to get you signed up for SSI. But unfortunately, it's missed. So let's go out there and make sure that happens. Exactly. Tomorrow could be a bad day. Yes, absolutely. Life is what happens while we're making other plans. So every day above ground's a good day, right? Son had surviving child benefits under 18 after his father passed away in his 40s. Safe to assume that N was 75% of his father's PIA, and ex-spouse benefit for me at 60 would be. Yeah, so it's, yes, once, and that's automatic. If a child is receiving child benefits and the parent passes away, it's automatically switched to 75%. And then if the child is on the record, then that lovely that embarrassingly low $255 automatically sent out. So, and that's automatic. Ex-spouse benefits, same type of situation if it's a child in care. But in terms of surviving spouse, yeah, if you're talking at, getting it earlier, then there's a big reduction. So. If the unemployed dad gets the auxiliary child benefit, mom is not in the picture, but it has SSD, would auxiliary child in care apply? Yeah, if that child is receiving benefits, then, and the parent, doesn't matter where they are. If the parent is essentially staying home to take care of that child because the child is under 16 or became disabled before the age of 22, then yes, file for the child in care benefits. Absolutely. Unemployment is not Social Security. That is correct. Well, unemployment was actually started kind of the same time as Social Security in 1935 was kind of part of the original Social Security Act. So, yeah. So, but now, yeah, they're considered completely different. So, I have never applied for any benefits because I own a home. Yeah, that. No relevance whatsoever. No relevance for retirement benefits or survivor benefits or SSDI, Social Security Disability Insurance, or SSI or Medicare. No relevance to any of that whatsoever. You could own a $20 million home and receive SSI. It's terrible. But anyway, that's the reality. The government says, hey, if you're hard up, if you were making tons of money and then you lost all your money, you lost your millions of dollars because you got ripped off or something like that, lost your farm or whatever, and now you can't eat, you're hungry in a shotgun home in Mississippi just as much as you're hungry in a $10 million Bel Air, you could sell it, obviously. But you know what I mean? That's how the government looks at it, is people, if you're hungry, so you need it. So, and then you definitely sell your home. But anyway, that's a whole different issue. No, I'm confused. I collected unemployment years ago. It had nothing to do with Social Security. That is correct. Yeah. Unemployment today in, the modern era. Yeah. It's not connected to Social Security at all. It's completely different. Gladys, what's up, Gladys? My granddaughter has autism. Mother working. They said she makes too much money. Yeah. So, the granddaughter is in the household, and there's money coming in that household. So again, SSI is supplemental security income, but there is a case to be made for applying. So so you've got some type of records, or at the very, very least, start getting those records now, because now that the child has to be disabled before the age of 22. So start keeping those records now. Whatever, school records, medical records, and just start collecting those now. And that way, when the mother in the future starts collecting retirement benefits or whatever, then you can start the filing to prove that the child did in fact become disabled before the age of 22. So you've got everything all set up there. So my father had a big estate. Social Security filed it. I went by the list of attorney and account. SSA put the check in the mail. Okay. I'm behind. I am on disability, but drawing under my husband. I guess nothing but that and no retirement. Okay, so you're drawing under your husband. So you're what's called disabled widow's benefits. If you're receiving your disability on your deceased husband's account, then that's called disabled widow's benefits. If your husband is still around, sounds like your husband is still out there, maybe next to you right now, then you're not receiving disability on his record. You can only receive disability on your own record. So maybe you're receiving, you are receiving disability yourself, and you're also receiving spouse benefits from him. And he may be receiving disability benefits, but it's technically retirement benefits. So I get what you mean, but it's important. It's an important distinction, because this is one thing a lot of people miss, is they don't know what they're getting. So they don't understand the rules and regulations, and therefore they're making their lives crazy, super difficult. For instance, you know, us in our community here, we get people all the time in the comments and saying, I get disability, I'm 70 years old. No, you're not receiving disability. You are receiving regular retirement benefits. Your disability stopped when you hit your full retirement age, and the check stays the same, and most people don't know the difference. But the important thing is because you're not receiving disability, you're not going to get any CDRs, the continuing disability reviews, and you're not limited to the amount of money you can work. We see a lot of people every single day that says, yeah, I'm 70 years old, and a friend offered me a job just hanging out at the store, and I don't want to take it because I'll stop my disability. You know, it's super easy. I just sit there and, you know, whatever. Take it. You're not on disability. You can do whatever you want. Make your life easier. Go out there and get out of the house and sell worms at the local bait shop or whatever. So when you reach FRA, what's your plan for Social Security? Oh, gosh. That's 7 years away. Yes, it looks like it was 7 years past, but it was 7 years away. So yeah, I have no idea. Yeah, I have tentative plans, and then I try not. I'm probably going to start receiving my benefits at my full retirement age. So unless life happens, and hopefully I don't have to file for disability tomorrow, right? But we never know. We never know. Did Dr. Ed email any of you about the new website? Yeah, no, not yet. Nope. I've got my list of everybody. I got like 4 from Florida, 3 from Ohio. This is the top ones, 3 from Texas, 3 from California. So those are the people that are interested in testing the new website that's going to help people throughout the country make sure they continue to get their benefits. And most importantly, even if you're not receiving benefits, it's a website for other people to support those people emotionally or in whatever ways, mostly emotionally, and or also help those people navigate the system, you know, give them tips, tricks, and secrets and stuff. So yeah, people helping people. So yes, I've got those 4 states that have the most. So if you're interested in testing, so what I'll do is once I get it fixed up a little bit more, I'm going to reach out to y'all. You'll email me, and I'll allow you to go into the website and start playing around with it, and then give me any feedback you have so we can make it the best thing possible out there. This is going to be, if we do it right, this is going to be the most useful website in the country for people that need to navigate this bureaucracy. So hopefully that's our wish. One more step on my Form 131, an approval for someone on $19,000 overpayment. I'm laughing so hard I don't cry. Yeah, I'm sitting on a power cake, slick as slow walk. Overpayments, yes. Overpayments are a nightmare. Doge, when they came in, they changed the overpayments, and then they changed it again, and then they changed it back, and because they don't really know what they're doing, they don't know anything about Social Security. So they're just throwing stuff, spaghetti up against the wall and see if it sticks. But that part, as luckily the overpayments for now has kind of calmed down a little bit. So this is kind of what they were doing. It's like one day this, and a few weeks later they change it. But if you have an overpayment, so make sure you check out my website, and it tells you all of your options on appeal rights and requesting a reconsideration and a waiver, and also requesting a lower rate of withholding. So you have appeal rights. You always have appeal rights with everything you do in terms of the government and Medicare Advantage. So let's see. There's a lot of fellow December birthdays in here lately. All right, let's see what else. LJ agreed Social Security, DO, and FO misled me by advising incorrectly that 6 months after 66, FRA has the option of suspension and payback. Should I bother to appeal? Okay, so the district office, field office, same thing. Misled me by advising incorrectly that 6 months after 66, FRA has the option of suspension. Okay, so you're talking about the delayed retirement credits. So I think I talked about this a little bit like yesterday, but starting with your full retirement age, you can actually suspend your benefits, called voluntary delayed retirement credits. And pretty much every month you wait, your benefits go up. In total, it goes up 8% every 12 months you wait to collect those benefits after your full retirement age. So it's called voluntary delayed retirement credits. And yes, there's a lot of Social Security field offices, district office, same thing kind of, that tell people incorrectly, and they miss those benefits. And there's two reasons, is that not many people do it. You know, once you start receiving benefits and you're like, oh yeah, maybe should I stop my check at, 67 years old so I can get that extra 8%? And not many people do it. And number two, not many people know about it. Less people know about it. So I think in my office, which is the third busiest in the country, I think in 5 years, we received one of those. So not many people use that at all. So when you go to Social Security office, they'll say, no, that doesn't exist. It does, they just don't know about it. So it sounds like you went to the administrative law judge and they said, no, you should have given that person a suspension, and you should have allowed that person to suspend their benefits so they can get those delayed retirement credits. So yeah, not sure why the ALJ. So the next stage on that is called the Appeals Council in Falls Church, Virginia. You don't need to go to Falls Church, obviously. So you just file this SSA 520, and it just basically, they send it to Falls Church, and those lawyers there look at the decision the judge made locally, the administrative law judge. So there's always that appeal right. So. Bill, I think the funeral home told us we cannot collect. Don't recall a reason. That was in 2024. I lost my mom in 19. Wow. Yeah. The survivor benefits and all of that. Yeah, we used to get people come in all the time. Yeah, my parent passed away. I was dependent on my parent. And sorry. Yeah. Unless you're under the age of 18 or became disabled before the age of 22. There is a program though called parents benefits. In reverse, this is one that I think we've got less people filing for this one than the voluntary delayed retirement credits. It's called parents benefits. It's basically if a parent is being supported by that child and that child passes away, then the parent can receive benefits on that child's record. If they're receiving benefits on their own record, then probably not eligible. But if the parent is not eligible for Social Security, essentially, and the child passes away and the parent was dependent on that income from the child, then that's called parents benefits. So that don't happen very often. So Let's see here. I have two adult children that live at home. One wanted hamburger helper. The other sloppy show. The big what? Okay, all right. All right, I've got some video questions here, and remember on my website. Let's see if I'll pull it up here on my website. On the bottom, can you see it? On the bottom left there, where it says question or comment, you can click on that, the little camera icon, and it brings up a little thing you can record a video and ask a question. And like this young man that we're about to hear right now.
June 8th, my wife got her Social Security check, but then June 14th, she died, and I have applied for survivor benefits. July 23rd was my appointment date, and still haven't heard any response from them yet. I've tried calling. They did call me back September 3rd and told me I had 60 days. Well, it's September 15th now. Still haven't heard if I'm going to get it or not. And I heard I'm supposed to pay that money back, but they haven't asked for her check back yet.
Okay. All right. So yeah, there's some done. Yeah. Sorry for your loss. Um, so if if someone passes in a month, person has to be alive the entire month for Social Security to get that check. But remember, Social Security always pays a month back. So the June check comes in July. So if your wife got a check in June, she was eligible for that benefit because that was the check for May. So May check comes in June. If a direct deposit was put in July, then she wouldn't be entitled to those benefits because a person has to be alive the entire month. So in this case of June. And what happens is when the funeral home or the coroner's office, whoever, notifies the state of of the person's passing, then the state has a deal with the Department of Treasury and the Social Security, and they close out the record and they automatically take that money back. So the Department of Treasury goes in there and grabs that money out if that person is not eligible for that particular benefit. So that's probably what the deal is. So maybe the Social Security employee said, hey, if you're receiving another check here because whatever, remember you got to pay that back. But if you don't get a letter that says we overpaid you, then the Department of Treasury probably already took it back. So on the other part, that when you say 60 days, that triggers a couple of things. Number one is they didn't actually take an application for survivor benefits. And what they did is maybe they scheduled an appointment or something like that, or gave you a preliminary appointment and, said, okay, you're gonna file this and this and this. And then the 60 days comes up when they say, okay, we've got you set up an appointment, but remember, this is not a full application. You have X amount of days, 60, 90 days to actually file the application. So maybe you didn't actually go through the entire process of filing. So I would reach out and say, hey, basically, what's going on with my check? And the other thing that 60 days denotes is appeal rights. So maybe your benefit amount is higher than her benefit amount, and therefore you're not entitled to benefits on that person's record. And when you called and say, hey, where's my check? And they say, well, we already decided that you're not eligible, but if you disagree, you have 60 days to appeal. So yeah, the 60 days thing, that just kind of a red flag that there's maybe another issue there. So if you called the local office and you're not getting any help there because maybe they just don't have any staff in the local office because Elon Musk and Doge, kicked everybody out, I would call the 800 number. Call the 800 number, Social Security 800 number, and say, hey, because they'll be able to look at it and the status of everything and find out what's going on. So that might be another option for you. All right, see what another question we have.
Hi, Ed. Thank you so much for all you do. I recently received a letter from Social Security telling me that I had an overpayment of $877.34 in January 25 of 2020. I do not have those records. However, I did call them. They said that it was between August and November, and also that I had reported my earnings, but they said that they were doing an addition due to the pandemic, and that somehow that money was more than I was supposed to get on SSI. I don't even recall being on SSI, but so they said for me to file a waiver for the overpayment that I cannot afford to pay back. And on the letter, it says if it's under $2,000, they are supposed to give me a waiver and that I don't have to file the papers. So I'm very confused. And if you can help me in any way, I'd really appreciate it. Thank you.
Yeah, there was a lawsuit during the whole, after the pandemic, about people that were getting paid incorrectly because of the pandemic and stuff like that. So that's probably where it is, or why it started. As part of that lawsuit, they were going back through all those records and triple checking everything. And in your particular case, they said they paid you too much. So you can, if you want a record, you can do this orally. So it's under $2,000. Yes, you can request the a waiver of the overpayment orally. But if you want to do it more officially, then wait, let me get the overpayment part here. It's an SSA 632, the request for waiver of an overpayment, or they really need to consolidate these two forms. The SSA 561 is saying, I disagree with the nature of the overpayment. You did the calculations incorrectly, so you could actually use that one if you wanted. But this 632 is like, okay, yeah, it's correct, but I think you should waiver it because of good conscience, and I don't have the money to pay it back, and it wasn't my fault. But anyway, you can, in your particular case, you can do either one of those, and you can actually do it orally. Call them up and say, I disagree. I want to file an official oral request for a waiver of that $800. It doesn't sound as though they're taking it out of your benefit amount yet, the $800. But if for some reason you lose that battle and they're not able to waive it or whatever the case may be, then at the very, very least, you can set up a payment plan. And now there is 60 months. So you can pay a little bit every month for 60 months and there's zero interest. But on that particular thing, on your particular, I probably wouldn't set up a payment plan immediately. I would fight it. Yeah, because just make sure they double check the calculations, and then, yeah, not sure, yeah, why you're on. Most of it is SSI type stuff, so not exactly sure why you got that. If you weren't on SSI, should it, unless you were receiving SSI and other benefits as well, right? So, Ed, can you explain everything there is to know about PPOs? I know nothing. Yeah, so those are the ones that the health insurance, the Medicare Advantage company, well, PPOs are, regular health insurance too, but Medicare Advantage plans, a lot of them are getting rid of those. There's about 1 million people that are going to receive letters this month that says, we're canceling your Medicare Advantage PPO, because as Ari from Chapter, who joined us here last week, says, Medicare Advantage plans, they're either in one or two stages. They are in the expansion stage, or they are in their margin stage. Their expansion is, hey, let's get all these benefits to these people and, and be so enticing. We get more people to join our Medicare Advantage plan, and we're going to give all these goodies and all this kind of stuff. And we want to get more and more and more people signed up. That's their expansion stage. And then now for 2026, they're in their margin stage. They're going to be canceling 1 million people off of those plans and say, yeah, because we're not making enough money on PPOs. And the difference is you got the two basic differences is a PPO is you can see even doctors that are out of network. If they take, the plan, Medicare and stuff, you can see doctors out of network, but you're going to be paying more. And HMO is you can basically only see doctors in network unless it's an emergency type situation. But with an HMO, you can only see doctors in network. PPO, you can see, whatever network, and, a PPO can have a network. So a company says, okay, yeah, you have PPO, you can go see any doctor, clinic, or hospital you want to, but we've got this network, and if you stay within that network, it's going to cost you less, but if you go out, it's going to cost you more. And their accountants ran the numbers, and they determined that those plans weren't making them enough money, and they're looking for profit margins for 2026. So they say, yep, we're just going to go ahead and cancel all these PPO plans. Which if you're in a big city and there's a lot of doctors and hospitals and clinics to choose from, most people get an HMO because there's a lot of choices. But it's really going to hurt those people out in the country, out in the rural areas, out in the desert, out west. It's really going to hurt those people because they don't have a lot of doctors and their HMO was terrible. So they had to get a PPO. So yeah, rural American is really going to hurt in 2026 because you've got that, and you've got all the cuts to Medicaid, and you see every single day that hospitals are going to be, shutting down or cutting back their hours or getting rid of this service and that service because of the coming cuts to Medicaid, and the increasing premiums for the Affordable Care Act marketplace. And yeah, we've had a healthcare system that was just kind of on the precipice of a cliff, and the big beautiful bill just, kicked it off. So it's going to be a crazy year. So that's another reason we're putting together this new website to help people, navigate the craziness. But it's all a community effort. So, all right, this will be the last questions. We're out of time here. Approved for benefits, entitlement date November, was suspended due to my working till end of the year. Do I need to do anything, or will this start in January? Looked at online, has me suspended. Yeah, so you're making over the benefit amount. What will happen is if you said that you're going to make, $10,000 over, the annual earnings limit this year, which is the $23,400, they will assume you're also going to make $10,000 over next year. And then whatever the annual earnings limit for next year, if it's, 25,000, then they're going to hold back $2,500 with the checks. If you so they will hold back January and February. So if your benefit amount is, let's say, $2,000 a month, and they're going to hold back $2,500, you think they're going to hold back $2,000 plus $500 in February? No, they don't do that. No, they don't hold back part checks. You won't get a check in January, and you won't get a check in February. They'll hold back both of those. So, but they'll add those months back when you hit your full retirement age. So there is that. Unless this will happen automatically, they will just assume you're going to make the same amount next year as you did this year. Unless you call them up and say, no, next year I'm going to really reduce my earnings, and I'm going to stay. I'm going to stay under the 23,000 or 24,000 or 25,000. Then you're not going to get your benefits withheld at all. So there it is. All right. We're done for today. I'll be back again tomorrow and come up with another topic and answer a whole bunch of questions. So if I missed your question today, I apologize, but I'll be back again tomorrow. Y'all have an awesome night, and please, 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 please take care of each other. Bye-bye.